What would you recommend as successful treatment options that are available, Dr. Azman, to take care of the dry eye syndrome?
Well, today we have a lot of treatment options out there, and the treatment options truly depend on the type of dry eye you have and the severity. Let me give you an example. There are two general categories of dry eyes. One is called evaporative dry eye, and one is called aqueous deficiency.
Okay.
Depending upon which dry eye you have will determine how we treat the problem. Okay? And then depending upon the severity of those problems, that also helps determine how we treat the dry eye. As far as options in treatment, once the evaluation is done and we go over all the possible ways of treating it, most options will range from prescribing over-the-counter eye drops, and there are many different types of over-the-counter eye drops, and depending upon which drop is best, we'll prescribe. Some patients will need prescription eye drops. Some patients need oral medication. Some patients need a procedure called lid hygiene, which can range from a thing called lid expressions to just keeping the lid margins very, very clean. Some patients need lid surgery, and some patients need laser surgery. So depending upon the evaluation, which is the only way you can determine which type of dry eye you have and how severe it is, that's when we can prescribe the options.
And what type of results would you feel are now available based on the many treatment options that you have available to eliminate the dry eye syndrome? What are we looking at results-wise?
Well, results-wise, if a patient has a more of a marginal to a mild dry eye, the success rate is almost 100% for those patients.
Very impressive.
If they're treated properly with the right medication and in the right sequence. And let me explain, sequence is very important. A lot of doctors think you just prescribe certain medications, whether it be eye drops or oral or topical eye drops. But there's one more factor involved, the sequencing of them. For example, if a patient has an evaporative dry eye and an aqueous deficiency dry eye, you always have to treat the evaporative dry eye first. Okay. If you try to treat it the opposite way, you will not be successful. So getting back to success rate, prognosis we call it, marginal to mild dry eye treatment, when done properly in the proper sequence, it's almost 100%. When you get into a moderate dry eye, the success rate is probably around 80 to 90%. Severe dry eyes, between 20 to 50%. So as you can see, the severe dry eye is the most difficult eye to treat, and these are the individuals that have very, very severe symptoms.